Here is what your non-bedside resume could look like. So this is an LPN with a few years of experience. She has an interest in healthcare information and administration. The profile is one of the areas I focus on the most because it's like a summary that needs to be quick, specific, thorough, but not too long. So we start off with stating that she's a nurse and what her clinical experience is in. But we state that her clinical specialty in her area is paired with a technical skill set that supports facility gaps in utilization review, informatics, clinical documentation improvement, and revenue cycle operations. We just threw out a bunch of keywords. We made a broad statement that captures most of the non-clinical jobs, but we state that her technical skill set supports those areas. So it's almost like a catch-all phrase. Then we talk about her passion, which is in improving healthcare management, and her unique aspiration in managing clinical data. Right? Because that's what you would do in healthcare and information and administration. The rest of the resume is going to prove the statement we just made. And up under her key skills, I organized it in such a way where we're talking about the skills that are related to healthcare informatics and data analysis, the skills that are relative to her clinical and care coordination experience, and then the skills that are relative to her professional communication and how she collaborates. We've got a section right here over to the side where we're already going to catch the licenses and certifications and her education. Her entire resume right now is on one page, including her email and her phone number. Notice that I don't have a list of the job and the year and what she did at each job and year. This is more of a functional resume versus the traditional resume. So it kind of depends on what you're going for and what might work best to catch the attention of the employer. We definitely made sure to list the technical programs that she's worked with because she was great. She actually did have some experience with data analysis. So I thought that was amazing. And so the goal here was to capture everything clinical and non-clinical on one quick page and leave room for questions for them to call and say, okay, can you tell me more about your work experience? And that's how you start to open up more opportunities for interviews. If you want a full resume tailored towards non-bedside jobs, I can help you craft one that opens up more opportunities for interviews. Book your 30-minute free call strategy with me so we can start talking about how to make your transition more smooth and more successful.